RMS Medical Products welcomes you to our in-service training presentation, How to Administer Sub-Q IgG with the Freedom 60 Syringe Infusion System. Freedom 60 is considered the pump of choice for sub-Q IgG because it's portable, easy to use, and promotes patient self-administration. There are no batteries to charge or replace, and special precision tubing sets are used to control the flow rate. Freedom 60 accepts a full 60 ml syringe and easily handles multiple needles for less frequent administrations. There are no concerns of runaway, free flow, bolus, or overdose with Freedom 60, and it maintains full pressure during and after an infusion to prevent drug backflow. The Freedom 60, unlike complicated electronic pumps, operates at a constant safe pressure and will automatically decrease the flow rate if there is an increase in resistance during the delivery. This balance is called dynamic equilibrium. Electronic pumps, on the other hand, increase pressure in order to keep up with a programmed flow rate, often causing pain, discomfort, and possible tissue damage. Freedom 60's dynamic equilibrium significantly improves patient comfort and minimizes complications. Your first steps in starting an infusion is to clean your work area with alcohol or disinfectant soap and water. Wash your hands thoroughly and assemble your supplies. Next, fill a 60 ml BD or monoject syringe with the required dose and purge it of all air. Do not use Terumo syringes or a syringe smaller than 60 ml. The Freedom 60 was not designed for use with these types of syringes. Verify that you're using the proper rate control tubing set recommended by the Freedom 60 IgG calculator. Note that the labeled flow rate stated on each package is true only for antibiotics and solutions with low viscosity. The IgG calculator will determine the proper tubing set to use per patient by taking dose, number of sites, time, and drug viscosity into consideration. Now, using sterile technique, remove the cap from the lower disc end of the tubing set and connect it to the pre-filled syringe. Then, remove the cap from the opposite end of the rate-controlled tubing set and connect it to the sub-Q needle set. Now that you have prepared the syringe and required tubing, it is time to load the syringe into the pump. First, verify that the pump is in the off position and that the black tab inside the syringe shield is at the end of its track. If the black tab is not at the end of its track, fully wind the large knob clockwise. Note, you will never need to use force to load or remove a syringe. When loading or removing a syringe, always make sure the black tab is in its proper position at the end of its track. With syringe gradations facing up, insert the syringe plunger first into the syringe shield and make sure the lower disc is fully seated in the pump's nose. The lower disc is an essential part of the pump's operation and it minimizes set contamination. Now, turn the pump on to prime the tubing, but try not to let any medication drip out of the needles. Inserting wet needles activates the mast skin cells that can cause painful swelling, irritation, or redness at the site. To stop flow to the needles, turn the pump off and wind the large knob clockwise so that the black tab is no longer touching the syringe. This will release pressure on the plunger and stop the flow. Now it is time to prepare the infusion sites. Remember, subcutaneous infusions can be given in the arms, legs, or abdomen, and the sites should be at least 1 inch apart. Cleanse the selected sites with alcohol. Once dry, pinch the skin and insert each needle subcutaneously at a 90-degree angle. Secure with adhesive dressing. After inserting the needles, check the sites for blood backflow. To do this, remove the syringe from the pump and pull back gently on the plunger for 15 seconds. Make sure no red or pink exists in the line. If blood backflow does exist, clamp the flow to the affected site or sites and refer to the Freedom 60 IgG calculator to determine if the dose can be run using the remaining sites. If so, continue. If not, remove all needles and start again using a new needle set. Now that the syringe, tubing, and sites have been prepared, insert the syringe back into the pump and start the infusion. Once the pump is turned on and the black tab meets the plunger, the syringe locks into position and the wind-up knob is disengaged. The pump can be used in any position and will be silent for the entire administration. Once the infusion is complete, turn the pump off and wait 1 to 2 minutes before removing the needles in order to ensure that the medication has been completely absorbed. Wind the large knob clockwise until the black tab is at the end of its track and remove the empty syringe. Dispose of all used materials into their proper receptacles. Cleanse each site and cover with a bandage. Remember, in the case of an emergency, such as anaphylactoid reaction, use the slide clamp to immediately stop the flow. The Freedom 60 requires very little maintenance. Just an occasional wipe down with a non-alcohol-based disinfectant will do. If cleaning the syringe shield, use a bottle brush. Never insert your fingers into the shield or touch the black tab for any reason. The black tab is sharp and operates under high force. If your protocol requires bench testing, please refer to the instruction manual. Congratulations! Your training is complete and you are now ready to infuse with the Freedom 60 syringe infusion system. Please keep in mind that while this presentation was for the infusion of IgG, the Freedom 60 can also be used for antibiotics, chemotherapeutics, Desferal, pain management, and cardiac medications. If you would like additional information or have any further questions, please feel free to contact our office. Thank you. If you're experiencing any difficulty with an infusion and need help troubleshooting, please continue to the next portion of this presentation. Here you will find answers to our most frequently asked questions. What do I do if a patient experiences site reactions, such as pain or inflammation at the site? First, try inserting sub-Q needles dry. IgG tends to irritate the skin. Second, make sure the needles are long enough to reach your patient's sub-Q layers. You may also want to try using a slower flow rate tubing set, especially if this is the patient's first time with sub-Q IgG. Lastly, think about site location. If this is not your patient's first time with IgG and they used sites in the past that did not cause pain or discomfort, it may be preferable for them to return to those sites. What do I do if the infusion is taking longer than calculated? First, infusion time may be slow based on how well your patient's tissue absorbs medication, especially if this is their first time with IgG. The body needs time to create space in the sub-Q layers in order to absorb in the time desired. If this is not the patient's first time with sub-Q IgG, check the needle sites. It is best to avoid areas of scar tissue or on top of muscle. It is also possible that you need more sites, longer needles, or a faster flow rate tubing set. If you are experiencing difficulties with the operation of the Freedom 60, your first step should be to test the pump. Begin by examining the inside of the syringe shield and ensure it is free of debris and contamination. Make sure that the pump is in the off position and that the black tab within the syringe shield is at the end of its track. If the black tab is not at the end of its track, fully wind the large knob clockwise. Turn the pump on and watch that the tab moves smoothly the full length of its track, listening for the following sounds: a click as the pump is turned on, a whirling sound as the tab moves forward, a click as the tab reaches the end of its travel. Also, test that the syringe tension tab operates freely by adjusting it forward and backward with your finger. What do I do if the medication is not flowing? First, make sure the pump is in the on position. Next, check that the slide clamp is unclamped or has not been used for an extensive period of time. If the slide clamp is overused, it can damage the tubing and affect the flow rate. If the pump is on and the slide clamp is disengaged, test the tubing. Using sterile procedures, disconnect the tubing from the needle set and check for medication drip. If medication drips from the tubing set, it's most likely a problem with the needle set. If medication does not drip, replace the tubing set as it may be damaged. What do I do if I'm having trouble loading or removing a syringe? You will never need to use force to load or remove a syringe. When loading or removing a syringe, always make sure the black tab is in its proper position at the end of its track. If the black tab is not at the end of its track, make sure the pump is in the off position and fully wind the large knob clockwise. What do I do if the syringe ejects from the pump? First, make sure you are using Freedom 60 rate control tubing with the lower disc. Next, make sure the lower disc end of the tubing set has been connected to a 60 ml BD or monoject syringe and that it is seated properly in the nose of the pump. Lastly, make sure you have not attached the syringe directly to the sub-Q needle set. If you have any questions that have not been addressed in this presentation, please feel free to contact our office. You may also visit us online at www.freedom60.com.